Hello, good morning, good afternoon to everyone. Thank you for joining us today for the Ask the Expert Live on treatment and care. Just before we get started, I just want to let everyone know that this session will be recorded and will be shared on our website. Also, please keep your mics and videos off at this moment. And if you have any questions, please be sure to post them in the chat with your email address, so that if we don't have time to answer all of the questions, we can get back to you with any answers. So with that, I suggest we get started. My name is Perka Ahmed. I work with the synthetic drug strategy here in Vienna at UNODC. As a part of the synthetic drug strategy team, I work on managing the UN Toolkit. The UN Toolkit was created to support the international community in countering the global synthetic drug problem. And it's also part of the synthetic drug strategy that was developed by UNODC. The toolkit brings together a wide range of tools and resources from across the UN system. And the UN Toolkit is very easy to use. And to show you how easy it is to use, I will share my screen now and walk you through it. So just give me a second. I will pull up my screen. So you should be able to see my screen now. I find the easiest way to get to the UN Toolkit is through the Synthetic Drug Strategy webpage, which is syntheticdrugs.unodc.org. When you come here, you'll see our landing page, which has the synthetic drug strategy here in all 6 UN languages, as well as information about implementation, upcoming events, other videos about what we've done so far, and of course, the UN Toolkit on synthetic drugs. The toolkit is available currently in all 6 UN languages, and today I will take you to the English page. Here, when you land, you can register to enter the page. Registration is very quick and easy, and I will show you how quick and easy. There you go. And then you'll get a link for the toolkit page. So here we are. This is the landing page for the UN Toolkit on synthetic drugs. Up here, you'll see you can access it in all languages. It's Russian, Spanish, French, and Chinese. Going back to the English page, we again have highlights from the toolkit, upcoming events like today's, and our Twitter page. To access the toolkit itself, we click here. This brings us to what we call modules, and each module offers a distinct set of resources and tools from the UN system. So we have tools from WHO, from various sections of UNODC, like cybercrime, criminal justice. We also work with the border management team, and each of these resources are included in each of the respective modules. As you know, today is about treatment and care, so I'll take you to this page. Here, each module offers sort of a summary about what's in the toolkit. Here we have treatment and care. So you see that the section is divided into sub-questions, focusing on drug use disorders and the management of drug use disorders, opioid overdoses, and treatment of drug use disorders. When you click into each subsection, you'll find additional information. Here we have WHO and UNODC guidelines for policymakers, healthcare providers, and other key figures in the management of drug use disorders. Going back, we can also look at how can opioid overdose be prevented and managed. Again, information as well as guides and tools available. The idea is that regardless of your sector or your level of expertise, you can kind of explore the toolkit and get the resources that you need. Often what we find is toolkit users will bookmark certain pages or save some of these tools. Others prefer to return to the toolkit and explore other sections. But the idea is that these tools are all found in one place on one website. In addition to the resources itself, we have a page called Ask an Expert. Here you can submit questions. Today we'll obviously be answering questions live, but you can also just fill out this form here and we'll have an expert send you an answer about your specific question. Lastly, we also have the About page, which kind of provides a summary of each of the modules in the toolkit. So you can see all of them listed here. We're constantly adding new modules, so we really suggest toolkit users that when they register, we stay in touch with them and we keep them up to date on the latest ongoings of the toolkit. So with that, I will now get to today's topic, which is the treatment and care module itself. And I will stop sharing my screen also for this. We're very fortunate today because we will be joined by Giovanna Campello of UNODC. She's the Chief of the Prevention, Treatment, and Rehabilitation section here, and she's been with UNODC for over 20 years, and we're very fortunate to have her expertise. And I suggest we dive right into the questions, Giovanna, if that's okay with you. As I mentioned, when we went through the registration process, a lot of people submitted questions through the registration process, but please also use the chat, send your questions there, and yeah, looking forward to the conversation. So
absolutely.
We'll dive into actually one of the first questions we received, and this was from a healthcare provider actually in the US, and they asked, are there tools to help healthcare providers identify the possible use of synthetic drugs?
Yes, yes, there are. Is it okay, Perka, if I share my screen and I show people in the toolkit where there might be, you know, good pointers for
yes,
with regard to what they ask?
This would be perfect.
And so this is a very good question because it allows me to highlight some things. You know, synthetic drugs, yes, they are special in many ways, but in many other ways, they are just psychoactive substances and just, in inverted commas, psychoactive substances that can harm the health of people, including developing psychoactive use disorder. And therefore, to address this kind of phenomenon, a lot of the, you will see in the toolkit that a lot of the tools that we provide together with our dear colleagues at WHO are in reality tools that are valid for all drug use disorders and are relevant also for synthetic drugs. So actually, this is look, we have even one question is, how can drug use disorders be identified? That really speaks to the colleagues from the US that asked this question. And I think that your best starting point is here, the international standards for the treatment of drug use disorders. Why? Because we have published this jointly with UNODC and WHO. And everything that we published, all of the things that you see here, are one way or another summarized in this reference document. So I think that is your first starting point. And this is where you would find information on the tools that are best to assess. The speaker, the question came from a health provider, so I'm assuming maybe it's somebody that does not work in a specialized service, but works in a normal public health or health service and sees the public at large and would like to be able to notice those signals of possible use, possible disorders, possible problems, and be able to provide quick advice and maybe refer people for further treatment. There are very good tools for this. The most famous one is Assist. It has been developed by WHO and tested all around the world, but there are also others. And your starting point would be here on the standards to find it and to get that reference. And of course, as Perka mentioned, if you want, a more, a URL, a more specific a reference, please do feel free to come back to us on the Ask the Expert webpage, because sometimes, to give information in writing is more precise than just indicating to you where you can find information in this kind of context. Over to you, Perka.
Thank you, Giovanna. And yes, I'm sharing the questions also in the chat, just so you all can keep up with it, and also sharing the links that Giovanna has just referenced, so you can all keep track of it as well. So moving on to actually the second question. This question comes from a Toolkit user in Zambia.
Okay.
And they asked, what are the unique challenges of providing treatment and care to people with drug use disorders in developing countries?
I think that this is in my experience, it's of course the fact that developing countries sometimes have less resources devoted to healthcare in general, and including the treatment and care of drug use disorder in particular, is something that you feel. But there is I think that some of the challenges are not unique. Some of the biggest challenges that exist in offering quality treatment and care are not necessarily unique to developing countries. We all have to get our act together and embrace evidence-based interventions. That is still not the case in many countries, of course, including developing countries, but also sometimes high-income countries. And of course, I think, and maybe we will talk about it in a different way, stigmatizing attitudes that exist in the services towards people who use drugs and people with drug use disorders, that are seen as people that are maybe morally weak, that made mistakes, that need to be punished, or that are weak in will. And still that understanding that is based in science. The drug use disorders are a health condition that affects the way the brain functions, and is multifaceted, as we say, meaning that there are loads of psychosocial influences on the condition, and chronic, meaning that relapse is something that it is possible, in fact expected, and it's not the end of the world. And even in the face of relapse, services can help the person with drug use disorder manage the situation in a positive way. So all of this understanding has often not gotten through in many services in developing countries, but not only. And in this context, I think that I can point you not only to the standards, but let me try and see. I think maybe it was here where we had, yes, here you can see our training materials for service providers that are based on this understanding that I have just mentioned. Of course, they are based on the standards that I just mentioned before, and could help improve the quality of the services offered.
Okay, thank you so much. And I think, yeah, that's actually quite a complex question, right? Because when we use the phrase developing countries, in the reality, I mean, besides the access to resources, the specifics of it are also unique to each country, not only in terms of the drugs itself, but the access to resources, the need for resources, the type of resources. So yeah, no, I think that's a very important point. And let me just check the chat quickly to see if we have any questions yet. Yeah, please feel free to ask your questions in the chat. And also, if you want to, you are also free to email it to me if you don't feel comfortable asking it in the chat. You can also submit it through the website itself. And maybe we won't answer it today, but we can get back to you with an answer. So returning to the questions that we received, we had another one from Bangladesh, where they asked, we are seeing an increase in overdoses in remote villages in my country. What are some of the best practices for expanding access to treatment in these areas?
I just heard myself, I'm sorry.
Oh.
A very, very, very good question. And I think here I can point you to some resources that we have in the toolkit. Let me share it with you very quickly. I think it was, yeah, in fact, there is a question, it's even written in the link. We had a possibility some time ago to look into this very issue. One of the best ways to prevent overdoses is to offer good services for people who use drugs and people with drug use disorders. Now, that is sometimes not easy in rural settings because they are remote, far away. And so in this publication that you see here, we had explored the possible best practices, the use of mobile units, and of course, now this is even a bit out of date because the pandemic almost made us all into remote units because of the restrictions that in many countries were undertaken. And so there was a lot of experimenting in terms of delivering of medications or delivering counseling through remote means like the telephone, creating networks of counselors that could counsel on the telephone or, if possible, of course, via internet, but access to internet is another issue. So I believe, Perka, that in the toolkit we have a separate part that is devoted to COVID responses. And although we have that beautiful resource in terms of providing services in rural settings, also some of the resources under the COVID-19 section would be relevant indeed, because it was all about trying to make services arrive where it was not so easy to make them arrive. And some of the lessons learned could be very relevant indeed. I will add that we need more research. I mean, there was a huge enthusiasm that, yes, it can be done. I said, well, but let's also look at it, right? And let's look if the practice, the services that we are offering remotely are also good enough, right? But having said that, there were good experiences on which we can build with, including careful monitoring. I think that would be very relevant for the colleague that asked the question.
Yeah, I think you also make a really good point that sort of an update to this, not only because of COVID, but also, access to mobile phones, mobile internet has grown so much in so many parts of the world, which wasn't the case before. So I think that's definitely an interesting report to revisit. So to the fourth question, this actually came from a law enforcement officer, and they asked, what is a role for law enforcement and the judicial system to play in the treatment of drug use disorders related to synthetic drugs? I think you're
I
muted.
muted myself. I said excellent question. And again, not easy to give a straightforward answer, but good to point people in the right direction. So law enforcement officers are a key component of an effective system that responds to the needs of people who use drugs and people with drug use disorders, including those that use synthetic drugs. But of course, we all have also at the back of our mind the fact that some of synthetic drugs, particularly opioids, can be extremely potent, and they have been the cause in some countries of enormous increase in the number of overdoses. And so I think that there are multiple ways in which law enforcement officer can play a constructive and very effective role. I want to share my screen again because we have some excellent resources, in fact, in the same page. So under the rural settings, we have also resources on addressing drug use and drug use disorder in the context of the criminal justice system, which is not only prison, right? It's also all of the system before, including at the very beginning, law enforcement. So we started working on this a long time ago with this old publication. I still invite you to read it just because of the basic principle of thinking about treating drug dependence through healthcare and not punishment. But if you're interested in good practices, I think that this is better. This publication is more recent. We published it together with WHO. It's from 2020 or 2019, I believe. And in it, what we have tried to do is to find good practices all around the world of providing alternatives to conviction and punishment at all stages of the criminal justice system, starting from that very first contact of law enforcement officers with people who use or people with drug use disorder, and how the law enforcement officer can play a key role in moving people with drug use disorders or people who use drugs into a positive contact with the healthcare system instead of hitting immediately with the criminal justice system. And there are very good reasons to do that, because we know from research that providing treatment instead of prison is effective in lowering drug use, is lowering overdose, in lowering reoffending, in lowering prison overcrowding, and it's more cost effective than prison and is more cost effective than doing nothing. So all good reason why also law enforcement could find very useful to move people who use drugs and people with drug use disorder into healthcare. And another good example of this, very practical, is more in the context of opioid overdose. So here you have some details about our Stop Overdose Safely initiative, which again, we are leading with the World Drug Organization. And what did we do? We were working in 4 countries, and we took all people that were likely to witness an overdose. This, of course, included emergency people, but also police officers and family and friends of people who use drugs, maybe people who use drugs themselves. And all together, we trained them on how to use naloxone. Naloxone is a very safe medication that is not psychoactive and is not controlled, and that is extremely effective in reversing an opioid overdose. An overdose that is a suspected overdose that is suspected to be a link to opioids. The good thing is of naloxone is that if whatever is happening is not due to opioid, is still a safe substance, so you don't risk to harm the health of the person that you're trying to take care of. And we have, in the context of the SOS, we have very touching testimonies from all of the people participating, and how it was strange for them for once to be all in the same room, and how it helped the different groups understand each other and see each other as people and not as institutions or moral failings. So I think that this is something where law enforcement officer can be a real catalyst, and if the colleague is interested, we would be very, very happy to talk more about how to make this a reality in more countries than we have been able to.
Okay. Thank you so much. I also really liked this question, because I think when we talk about treatment and care, there is this tendency to only segment the sectors that we reach out to. And I think for me also, it's a reminder of why the toolkit is so important, because it kind of provides a wider audience for this. And what we try to do often enough in the toolkit, and you'll see, is we cross-reference different modules, because in the end, these modules do not exist in a vacuum. All of these topics are very interrelated with each other. And I think for law enforcement, it's just as important to visit, let's say, the legal and forensics module as it is to also explore the resources for treatment and care. So thank you. Actually, that was a really good reminder, and I think a really great question. The next question we have is from a treatment center, and they're asking, some patients we find are scared of seeking help for their drug use disorders due to the fear of adding shame to their family and relatives. How can treatment and care providers reduce this fear?
This is the $1 million question. But I think that we at UNODC, we have been very fortunate to have been able to start thinking about this question in different ways. So again, I will want to share my screen, and oops, this is by email, but that's okay. Let me find the toolkit again. What do I want to show you? We have an entire page, I believe, devoted to non-stigmatizing attitudes. It's not easy, but we had the possibility to do a technical consultation with experts from all around the world, and here you can find the links to some of the main ideas around how to improve services so that they are welcoming to people who use drugs and people with drug use disorders in different ways. In reality, in the end, to solve this really ingrained problem, it would need the response of an entire society. The services alone cannot solve this issue 100%, but there is a lot that they can do to make services welcoming and starting to treating people with respect, using non-stigmatizing languages. And I think one of the biggest lessons is to ask people who use drugs and people with drug use disorder themselves. So ask that question: what can we do to make the service more welcoming to you, more accessible to you, easier for you to access without feeling that danger? And in this respect, I also want to point out another tool that we have. Honestly, this is more of a tool that would not be that easy for a single service to use. It's more about the system, but also the service, I think, can look through and start thinking. Let me find it though. It's our quality stuff, Perka. I think it's here. No, it's not. Do you remember where our? Maybe it's here. No.
I believe it's under the capacity building question, which is the first question under treatment of drug use.
No, I don't see it.
Okay.
I know that it's there.
Okay.
And I'll ask everybody's patient for me to check quickly, because I don't want to send you to another part of the website. Although we will of course add it. I don't find it. I'm really, really sorry. But we have some tools that we will link here in a better way. I was pretty convinced that I've seen it, to improve the quality of services and systems. And I think that, of course, the tool to improve the entire treatment system would be a bit hard for one single service to take on. And even the tool for services, there is a lot of discussion, but I believe that it is a good reflection tool, and a colleague that is interested can really start looking through and say, like, do I have all of these kind of things that make sure that my service is of high quality and therefore more welcoming of the people who need it, the people who use drugs and people with drug use disorder. And yeah, and I think that those tools are completely based on the standard that I mentioned before. We took very strong care about that, so they could be also an additional starting point in addition to the ideas coming from the technical consultation on stigma.
Thank you. And I think it's also a reminder that stigma also has so many different layers to it, right? We have different types of stigma. You also have stigma felt by the individual themselves, but also through their families, through their communities. So I think, yeah, it's a complex discussion, and I think there's many layers there to sort of go through. And I do think this technical consultation, I'm familiar with this document. It has really great case studies also outlined in it. So you get really kind of specifics and very practical inputs, I think, on how to address stigma.
So I'm in contact with a researcher, and they are undertaking a trial in South Africa, I believe, where they are embedding in the treatment services team a person in recovery, and to become that advocate for the person with lived experiences. And, they are collecting data of how this is changing and how this is making the services more welcoming. And all these kind of ideas we got from that document.
Okay, amazing. Yeah, no, it's really important to have that voice in there. So I'm really interested to see how that research develops. Let's just check here. So another question we received, this one was from Argentina, from a user in Toolkit user in Argentina. They asked, what special considerations need to be made when providing treatment and care for drug use disorders to pregnant persons?
Oh, and
this is a good segue question, I think.
Yeah, and it's an interesting question, because also Argentina is one of the few countries where we have been able, together with WHO, to present our guidelines, which are in the toolkit. I know they are there.
Yeah, I also know they're there.
And they are together with the, I believe, in the special populations. No, they are with this here. Yeah, because here we have youth. Perka, help me. Where are they? Maybe here? No, they're in the main page, I think. Yes, here they are. And apologies, I still don't know my toolkit by heart. But it's very important. It's good that it's here. Why? In the standards I was mentioning, we have everything. So even in the standards, there is a specific section on treatment for women with drug use disorders, including a section for pregnant women. So here you have everything, but if you want to have an in-depth look on how to identify and manage substance use disorders, including, of course, drug use disorder, including synthetic drugs during pregnancy, this is your document. And this has been developed with our support by WHO themselves, and it's extremely exhaustive. And basically, of course, if I have to summarize it in a nutshell, it's like 200 pages, so it's not easy for me to give you an answer in a few minutes. But if I have to summarize it, we have some very good guidance on what it means to create services that take gender in consideration into account, and specifically the needs of women into account for special health care, the often history of abuse, and therefore the need to provide a safe place, trauma-informed care, so care that every step of the way keeps in mind that this person, the woman with drug use disorder, might have suffered very heavy trauma. And of course, deal with the issues of the childcare responsibilities that in so many parts of the world are still the almost exclusive exclusivity, sorry, of women. So there is that, and that does not change with pregnant women. But of course, pregnancy is a very special time for the mother to be and for the baby to be. And there are very important indications of what needs to be done in the case of different kind of use of different drugs and of connection to the prenatal and natal services. I will add a small connection to the prevention module. Why? Because when we looked at and developed the prevention standards, we included treatment for pregnant women because we had the evidence that if you provide evidence-based and voluntary services to pregnant women with drug use disorder, this has a protective effect to the healthy and safe development of the children as well. So it has a preventive effect as well. And it's really, really important to always remember that that is not the only reason why we should provide services to women who use drugs and women with drug use disorders. But let us know that if we do it well, it's an opportunity for everybody.
Thank you, Giovanna. I think also thank you for referencing the prevention module, because I think prevention and treatment often go hand in hand. I think a lot of the resources are also cross-listed with each other. So I think those of you who are interested in the treatment and care module, please be sure to also review the prevention module, because that's, I mean, this is, Giovanna knows the resources very well in there. And I think it's important that those are also explored and highlighted. So thank you so much for that. We have another question here, which actually also deals with a specific group, and we've actually mentioned them already, which is, are there special considerations for the treatment and care of young people with drug use disorders?
Yes, of course, and we have some resources in the toolkit as well. So, of course, we all know that most drug use starts in youth, right? And if we think about youth under 25, let's say, just because I know that the definition of youth varies all around the world, and I'm not saying that this is the right definition, it's just for us to all know what we are talking about together. And but if you think about not only children, so people under 18 that have started to use drugs, a lot of experimentation starts in under the age of 18, but maybe that younger people, children that have developed drug use disorders, this is an extremely vulnerable group, and it's very likely that people under 18 that have developed a disorder as well have been exposed to multiple vulnerabilities in their life, in their families, in their communities. And it's really, really important. And it's a great opportunity to addressing this vulnerability effectively means really supporting a lifetime of healthy life. Let me show you what we have in particular. Again, your first reference point is in the standards. This is where we provide, there is a section on addressing drug use and drug use disorder among young people, adolescents in particular, and it's very comprehensive. Now, within all that you can do, there is something that we picked up in particular. One of the interventions, psychosocial intervention, that had more evidence of effectiveness, and this is particularly relating to cannabis and stimulants. So if you think about those kind of synthetic drugs, the synthetic cannabinoids and amphetamine type stimulants things. One of the best research intervention is family therapy. So let me go back, because I know that I believe it's here. This is like a game of memory. There it is. You might know that family therapy is effective, but it's also not that easy to deliver. It requires trained professionals that have been trained for many years, clinical psychologists, things like this, and resources that in many countries, and not only low and middle income countries like we were discussing before, right, are scarce. So what we did is to take the developers of the main and best researched kinds of family therapy, and we asked them to distill for us the essential elements of family therapy. And in order to be able to deliver this with trained counselors, but not necessarily, clinical psychologists, and in settings where there might be less resources than high-income countries. And we have piloted this in Indonesia, Vietnam, I think this pilot might be ongoing in the Philippines, and now we are piloting it in many other countries as well, with very encouraging results in terms of lowering the use of the adolescent, improving the way the family works, improving the behavior of the adolescent in general. So I think that in addition, or maybe more in depth, to the general provisions that are included in the standards, this is a very important and effective tool that is at the disposal of everybody.
Thank you so much, Giovanna. Yes, and I think would also like to highlight that the TreatNet Family Training Package is also available in 5 languages, and it's a series of workshops, and it's linked through the toolkit. I've also included the link to the chat. So I think for many people, that will be an interesting page resource to have access to. I think we have time for just one more question, and then we can wrap up things.
Okay.
So I have this one question. This comes from Thailand. It was like, our hospital has seen a growing number of relapse cases with patients who have recovered from drug use disorders.
Yes.
Are there effective relapse prevention standards that can be included in our treatment services?
Very good question. So I was mentioning maybe before already how relapse, how drug use disorders, and specifically dependence, addiction, is a health disorder that is chronic in nature, meaning that is prone to relapse. That is the nature of the health condition, and it can be, of course, managed very effectively. We cannot expect, it's not realistic to expect to be able to prevent it 100%. A relapse will happen. One of the most important standards is for the services to be ready with open arms to welcome people with drug use disorder, people in recovery that are going through a crisis period and might have relapse, to help them manage the crisis in the best possible way and continue their recovery. So again, our main, how do you say, point of reference is the standards, because the standards really covers also everything from the very beginning to the what we call recovery management. And of course, this is where you have your indications of all of the services that are needed to support the recovery process and prevent as much as possible relapse. And this allows me to say something that I wanted to say at the beginning, but then there was no, I would have opened another parenthesis, but you know, we call this the treatment and care toolkit. But this is a bit, how can I say, it's an experience for being brief, because what we are really talking about is all of the services, healthcare, social care, treatment, all of the services that are needed to protect the health of people who use drugs and people who with drug use disorder, and support their recovery if they're so wish, support their therapy, of course, and recovery if they're so wish. So here in the standards, we cover everything from that very first contact, outreach, what is the needle syringe exchange, the kind of healthcare that is sometimes called harm reduction, through to therapy, and it can be pharmacological, opioid-assisted therapy, for example, or psychosocial, like the treatment family that I was mentioning, until the most acute phase of treatment has been concluded, and we need to support the recovery process of the person in recovery. So here you really find everything, not only in terms of all substances, but also all of the phases of care that are needed to support the health and recovery of people who use drugs and people with drug use disorder. So I hope there is something useful for the reader as well. But just to keep in mind, the principle is recovery is an open-ended process. Services need to be open, to be welcoming, anybody who is going through a crisis, and be ready to support people in recovery with a large range of socioeconomic issues that they might be faces, to facilitate that recovery process.
Thank you so much, Giovanna. And I think with that, all of the questions have been shared in the chat. I've also linked many of the resources that Giovanna referred to. Also, please, let's not stop this as the conversation. Let's feel free to submit your questions on the website. I will also share the link to the toolkit, the synthetic drug strategy, our webpage as well in the chat right now. And please use these resources. We're available to answer your questions. And I also want to make a note that we weren't able to address all the questions we received actually today. So we will be hosting a second session of this on Monday, the 26th, at a different time. It'll be 3 p.m. Central European time. And we'll have several other questions that we'll revisit then. Another thing I want to note is that the module was co-developed with WHO, PTRS, and thanks to the support of funding from the Canadian government. And thank you again, Giovanna. This was really amazing. You're really a wealth of knowledge, but also I think this information was really helpful, not only to everyone here present, but also we'll be sharing this recording on our website and on Twitter. So I think this will be really useful. And I look forward to our conversation continuing on Monday. So thank you so much.
Thank you. Thanks everybody. And if your time allow, I do recommend that you join on Monday as well, because I will not be alone. There will also be a colleague who is actually leading our treatment program. So if you think I did okay, she will do better. and she might have even more insight that I've been able to share. So, but other than that, thank you to the colleagues of the Synthetic Drug Strategy for making this possible and having us. And like them, we are at your disposal to support you in your endeavor in addressing synthetic drugs in any way that with trying to answer any question you might have. Get in touch.
Okay, thank you so much. I wish you all a wonderful day, and yes, I hope to hear from many of you again soon. Thank you, Giovanna. Goodbye.
Goodbye.